If you saw my last video, you'll see I talked about looking after scars after your abdominoplasty or tummy tuck. I'm going to now talk about looking after scars after your male chest reduction or gynaecomastia procedure. A lot of the basics will be very similar, but there are some nuances and some differences that you may want to bear in mind if this is a procedure that you'll be having. So if this is the first video of mine that you're seeing, I'm going to give you a super quick recap. First of all, I lost around 140 pounds in body weight and I had a lot of loose skin left over. I had that removed through a combined procedure, a tummy tuck and chest reduction procedure in March 2022. I'm recording this in October 2022. My recovery has been very smooth. There have been no complications. I'm very happy with the results so far. I'm through the most challenging parts of recovery, and now it's just a case of waiting for the scars to fully heal and for the last bits of swelling to go away. And of course, I need to add my standard disclaimer as well that I'm not a qualified medical professional. I'm sharing my own experience of these procedures and my understanding of the advice that I was given. You should always speak to your own doctor, the team that's going to be performing your procedure, or a qualified professional for any specific questions about your situation. And also I'm going to be talking about a couple of skincare products I use. And I mentioned this in the last video, but if you are going to be applying something new to your skin, please remember to do a small patch test on a discrete area to make sure that you don't have any adverse reaction. First of all, one thing to bear in mind is that these scars on my chest are slightly different to what is quite common with this kind of procedure. So what's quite common is that the incision will be along here and it'll go straight across, and any extra tissue will just be removed, and you have a scar going along kind of lower chest. My chest muscles were designed well enough that my surgeon could actually tuck the scars under my chest muscle and coming up under the arm. So if you have a look, you can see come through there, under, and to about here. And when I have my chest relaxed, it's still a tiny bit swollen, so it's not 100%, and the scars are still going to take a few more months to fully heal. But you can see it comes pretty much under the chest muscle, and it's quite well disguised. I wasn't too worried about hiding my scars anyways, because I figured if they really annoyed me, I could just tattoo over them or something. Something to bear in mind is that with the recovery, if you have scars in different places, that's going to affect how you care for them and how you look after them. And one more thing is that my nipples were actually grafted back on. So the tissue on my chest used to hang to about here. The nipples were kind of at the end of that. Once that was removed, they had to be grafted into place. Where they are now. For the first 4 weeks after my procedure, there wasn't a lot of direct care I could do for my scars or for my wounds. I had brand surgical tape like this covering my wounds entirely for the first 4 weeks. In terms of pain, I did actually find my chest wounds probably the most painful. Under the arms were quite prickly for a few weeks afterwards, and it was quite challenging to deal with. Not unbearable, but it was more noticeable than anywhere else. I also had very limited range of motion in my arms, so I was walking around with T-Rex arms for 3 or 4 weeks. And it also meant that I couldn't wear t-shirts. I was wearing button-up or zip-up tops. And also my nipples had a little bit of extra cover just because I was wearing a support garment, which is quite tight-fitting, and that can cause a lot of friction. So just to give them a little bit extra protection against that friction. From weeks onwards, I was having a lymphatic drainage massage once a week, which is to help with the swelling, and there's lymph nodes under the arms, so it's quite close to one of the areas where I was affected, and that's why it's really important to start getting that swelling under control. After 4 weeks, the tapes came off my wounds. The surgeon gave me the all clear to start doing some massage work on them. I was still freaked out by my nipples and I didn't want any sort of sensation in them, so I was using extra cotton pads to keep them covered, and then I was keeping those between my nipples and the support garment. In terms of my main chest wounds, front of chest, I was told to hold off for another couple of weeks before I start doing massage work on. They were a little bit more tender still. Under the arms, I was given the go-ahead to start doing some work on, and I was kind of more conscious of that because there was a lot more swelling there and the tissue was starting to bunch up a lot. After 4 weeks, I started using a scar treatment, a silicone scar gel called Kilo Coat. You just apply a thin layer to cover your scars and let it air dry for 4 or 5 minutes after you've had a shower, and then you can get dressed as normal and go about your day. And it's good for 24 hours, so you can just apply it again after your next shower the next day. Your surgeon may have their own recommendations on what to use, so please do listen to their advice. The only thing is that it did still feel a little bit sticky, so I ended up switching after a couple of weeks. So after 6 weeks, I got the all clear to start massaging my chest fully, so I started working on the front of the chest. I got more comfortable with my nipples, so I didn't have the extra cotton pads under the support garment, so that was cool. And then I switched from the Kilo Coat Scar Gel to another one I use called Derma E Scar Gel. It's less sticky, it's easier to absorb into the skin, and it's just generally more comfortable to use, and I've been using it for hyperpigmentation on my skin, which I get from acne. And I know my skin reacts well to it, so I just decided to go ahead with it. I do need to add my disclaimer again. Please do listen to your surgeon or your clinic or your treatment team and follow their guidance. And the range of my arms was a lot better, so I was back to wearing things as usual. It took around 10 weeks for me to get the full range of motion in my arms again, so I could reach overhead without it feeling obstructed or being pulled on. I mean, I did still feel some pulling, but that's when I could kind of get comfortable range of motion without feeling like it was actually stopping me. But what that also meant was that I could actually start to properly stretch and properly work deeper into my scars when I was doing my massage work. So if there are any little nibbling knots or anything, I could start to work on those a bit more. I was still doing that with the bent arm like this, but there's just something about being able to reach overhead just gives you a much better range to work with. Since I got my full range of motion in my arms, and now up to 7 months after my surgery, There hasn't been that much change in how I'm treating my scars, so I'm still massaging them twice a day. I'm still applying the scar gel twice a day, once in the morning, once before bed. The swelling has been going down. On my chest, it's mostly gone now. There's still some on the abdomen, but on my chest, it's mostly gone. The wounds are healing quite nicely. It can take more than a year to fully heal, so I'm just kind of waiting it out. But overall, the process has been very smooth. So yeah, I've got no complaint. One last note on my scar placement. You can probably see from the front that it is not entirely even. I was aware of that going into my procedure. There was around 50% more tissue that needed to be removed from the left side, so from this side. So it meant I was going to end up with a slightly asymmetrical scar placement, but the contour and the actual shape are symmetrical. So that's kind of what I really want. So while the scar placement's a bit uneven, the shape and contour are even, or at least as far as I can tell. And that's really what I was prioritizing. So I'm happy with that. But again, speak to your surgeon, get their opinion, get their advice. They'll be the best people to advise you on what to expect in terms of your end result.